Hello there, University of Charleston. Thank you, Aaron Weaver, for inviting me to speak about the healthcare system in Norway. Um, I work as a family physician in Bergen, a large town on the western coast of Norway. I work in an office with four other colleagues. I've been doing this for the last 30 years and I still enjoy this work. Um, Family practice in Norway. Let me tell you a little bit about that. It's organized quite differently than in the United States. Now, every person in Norway is assigned to a specific family physician and is supposed to consult this doctor for any health problem he or she might have. Each doctor has a list of about 1,000 to 1,500 persons, and I am obliged to provide health service for this group. In this way, I get to know my patients real well. I've been knowing most of them for a long time. I know their families, I know their jobs, and I know their medical history. But of course, if for some reason or other we don't get along and this patient feels I'm not the right doctor for him, he might choose another one. Now, family physicians will cover all kinds of different fields of medicine, and we do a lot of common procedures or assessment where you in the United States might want to consult a specialist right away. We see around 20 patients a day, and most of their problems I probably will be able to help them with. But of course, if it's beyond my competence, I will refer them to a specialist or a hospital or to different kind of investigations. But the patient will not be able to go straight to the specialist without my referral. Of course, unless they choose to use the private part of the health system, because we also have a private health system, but then you have to pay all the costs yourself. Now, a bit about the costs. It's not totally free. Norwegians older than 15 years old have to pay to see their family physicians or go to a specialist or an outpatient clinic. And they have to pay for some of their medications. But if these expenses exceeds $250 in a given year, the rest will be covered by the state. And all hospital all hospital care will be free. That goes for the stay in the hospital, the investigations, and the treatments. Everything is free. So I think that's a great benefit for the inhabitants of Norway, but this system is not without its flaws. The biggest problem in Norway is that we have waiting lists for a lot of treatments. For example, if you need a hip replacement surgery, there will be probably a waiting list for about 3 to 6 months, and people are not very happy about that. But if you have a serious condition, let's say I suspect that you might have an undetected cancer, I will refer you through a fast track system, so you will be seen by specialists in less than a week. So now I've told you a little of the Norwegian health system, and of course it's a lot different than yours, and you struggling with Obamacare and that stuff, it might be interesting for you to know a little bit about how we do it. We don't see this as a socialist system. Norway is these days run by right-wing parties, and there is no disagreement in this country about how to organize the healthcare system. So good luck with your work with this project and with your struggle and fight to do better for your inhabitants in the United States. Thank you.